Hello, everyone. Today, I wanted to hop on and share some thoughts about Social Security changes that are coming up under the Trump administration. Now, a lot of you have asked questions about what can you expect when it comes to Social Security changes, and I wanted to get here today and do a questions and answer session, answer some of your questions about Social Security, but then we can also delve into Medicare, Medicaid, food stamps, where there are possibly going to be more changes than a lot of people realize. So let's have an open conversation, a Q&A. If you have any questions at all, put it in the chat right now. But before we get started, let me know what city and state you are watching this broadcast from, because I like to know where our viewers are watching our broadcast every time I come on live. But today I wanted to talk about Social Security. So, what are the changes that are coming that you can expect? Obviously, at the beginning of the year, you saw the cost of living adjustment, which was 2.5%. So, the question is, why was the cost of living adjustment so low for 2025 when it was 3.5 the previous year, then it was 8.7, then it was 5.3? The main reason is that the government is saying that inflation has been trending down. Now, whether you believe that or not, that is the official government report that the inflation rate, it doesn't mean that inflation itself is down. It just means that the rate of increase in prices has slowed down. And that is why your cost of living adjustment was low. Now, I agree with a lot of you who said that the 2.5% cost of living adjustment was a joke. Now I am looking at the comments now. There's somebody from San Francisco. I see Florida. I see Jamaica, Queens. I see North Carolina. I see Hartford, Connecticut, Winchester, Virginia, Moline, Illinois. Keep them coming. I want to know where you're watching this broadcast from. But today is a question and answer session. So hit me in the comments. Let me know what questions you have about Social Security changes that are coming, about food stamps changes, where a lot of seniors are concerned that their food stamp benefits may be cut because of all the changes that are happening. I'm here to answer those questions. But specifically, I want to touch on cost of living adjustment. Why was cost of living adjustment so low this year at 2.5%? Well, it is because of how the government calculates Social Security cost of living adjustment. So let me explain how that works. So there is something called the Consumer Price Index for, CPI, and CPIW is how the government calculates your Social Security cost of living adjustment. And the W stands for the Consumer Price Index for urban wage earners and clerical workers. So basically, that is a lot of government speak for an inflation index that measures the price changes of goods and services that affect urban wage earners and clerical workers. Now, your question will be, why are they using an inflation index that tracks price changes for urban wage earners to calculate benefits for seniors? That is what a lot of people have been asking, but it has been this way since the 1970s when they started adjusting Social Security for inflation. And so there is kind of a disconnect between how the government is calculating your cost of living adjustment and the actual cost of living that seniors are experiencing in their day-to-day lives. And so that is why over the last 20 years, if you look at the cost of living adjustment that Social Security beneficiaries have been receiving, it does not really match up to the real inflation that is out there. That is why if you have felt that your Social Security check has not been reaching far, or the purchasing power of your Social Security check has not been going further, it is because of this. It's because the inflation index that the government is using is not matching the actual cost of living increases that seniors experience when it comes to prescription drugs, when it comes to healthcare, when it comes to food, transportation, housing, and other costs. And the other reason why your cost of living adjustment was low, because the government says inflation has come down dramatically from when COVID happened. And when they mean inflation has come down, they mean the rate of price increase has slowed down. But that does not mean, or that does not account for the fact that prices have gone up and stayed up in a lot of areas that affect seniors: food, transportation, housing, drug, Medicaid, Medicare. All those costs have gone up. And even if you talk about Medicaid alone, costs have gone up. Medicare premiums, Part B premium has gone up 6%, and your cost of living adjustment is 2.5. So I want to have a discussion with you. What do you think should be done about cost of living adjustment? If you are in charge, how much cost of living adjustment would you give every year, knowing that that money has to come from the Social Security Trust Fund, which is supposed to be depleted in 2033 when 79% benefits are going to be paid instead of the 100%. So increasing Social Security cost of living adjustment is also going to put a burden on the Social Security Trust Fund because all that money is coming from the same pot. So let me know your thoughts. What do you think should be done to adjust? One of the proposals in front of Congress, which I think is a good idea, is to change the way Social Security cost of living adjustment is done for seniors. And the proposal, the current proposal that I think it's good, is they're going to shift from the current CPIW, which measures the price changes that urban and clerical workers experience, to a specifically designed price index that is going to be called the CPIE, E standing for elderly, that is going to measure the true price changes that seniors experience. That proposal has been in front of Congress for a couple of years now. It hasn't gained a lot of traction, but I think it is the only way to fix the Social Security cost of living adjustment frustration that a lot of seniors experience. I am going through the comments. I see somebody from Minnesota. I see New Mexico. I see Chicago, somebody from North Carolina, Atlanta, Georgia. I want to know where all of you are watching this broadcast from. So hit me in the comment. I see Baltimore, Maryland, and Appleton, and so on. So that is the first topic I want to address. The second topic is there is a lot of noise about Social Security in the news. You've probably heard about Doge and Elon Musk and everything that he's doing. But the question is, what is really happening? And how is that going to impact you? Well, let's talk about a couple of things. The first thing is that they've laid off 7,000 Social Security workers. So what does that do? Well, the immediate impact of that is that when you try to make an appointment at a Social Security office, it may be an office that is close to you, that people have been laid off in that office. So it's going to take a while for you to get help when you go to a Social Security office. So you have to be patient. So that's the immediate impact that it may have on you, is that when you try to go to a Social Security office to apply for benefits or get disability benefit questions answered or apply for disability benefits, you are going to experience a wait time that is longer than usual. On top of that, they're beginning to close Social Security offices. So it is the same thing. It may mean that an office in your location or in your town or close to your location may be closed. And what that means is that it will then require you to travel further to get Social Security help. And then recently a report came out which actually they retracted that they were trying to cut the phone system or reduce how much customer service they provide on the Social Security lines. Now, 40% of all Social Security applications are processed over the phone. So the idea that they were going to cut the phones got a lot of people upset and they backed off. But even in the current situation, Social Security wait time on the phone is about 3 hours in some cases. Somebody from California commented on one of my videos recently that they were on the phone with Social Security for 3 hours. So my question is, there is a lot of noise around Social Security. What do you think should be the priority for them right now regarding you and your benefits? How do you think Congress and the president should approach fixing Social Security? Because, guys, let's face it, we all know, or if you don't, today's a good time to research this. The Social Security Trust Fund is going to run out of money in 2033. At that point, if Congress does not do anything, if the president does not do anything, you're only going to receive 79% of your benefits. How did we get here where people have paid into a system and now are going to get, 21% reduction? Some even propose that it may go as far as 25% reduction in 2033. So let me try to explain what is happening regarding the math. Now, I know there's a lot of issues here, including the fact that Congress dipped into Social Security funds and never paid it back. The fact that the money people are paying into Social Security benefits goes into the general fund. All that is true. But here's also another fact, that there are demographic challenges that are confronting the Social Security system, that something has to be done. And I'm going to explain the options that are out there. There are 5 different proposals about fixing Social Security. I'm going to explain all 5 of them to you tonight, and you're going to decide what you think is the best approach. But let's talk about how the system works right now. A lot of people think that Social Security is like a 401k where you pay money into an account and then that account grows over time. And then when you're ready, you get the money. Like your name is attached to an account. Well, it is yes and no. Yes, because you've paid the money into the system, but no, because Social Security is a pay-as-you-go system. And guys, don't come at me. I am just telling you how the system works. This is something you can Google and learn for yourself. But I'm just explaining to you how the system works and why the system is in crisis. So the Social Security system is a pay-as-you-go system. It is people who are working now are paying the retirement of people who are collecting benefits now. That is how it has worked forever. So that is something we can all agree on. That is a pay-as-you-go system. So if you are withdrawing $1 billion every month from the Social Security system, you need $1 billion coming in. That's a rough estimate because they are investing some of the money, there's interest and all that. But I'm giving you a rough estimate. Money coming in has to equal money going out. When the money coming in is less than the money going out, then there is a surplus, and that surplus is kept in the Social Security Trust Fund. So that trust fund ballooned over a period of time. And I think some of you have been commenting that Congress raided the trust fund and used it for other things. Okay, assuming that that is the case, the trust fund had a pot of money. And then now we are in a situation where the amount of money that is going out of the Social Security system is more than the amount of money coming in. It means the payroll taxes that are coming in is less than the amount of money that is being paid to retirees. That's just simple. That's a fact. We can all agree on that. Whether the money should have been invested properly, whether it wasn't invested properly, whether Congress took some of the money and spent it for other things, that's another discussion we can have. But the fact right now is that the money coming in is less than the money going out. Less people are paying into Social Security than the money that is being paid out. So now who makes up the difference? Well, if you are bringing in 800 billion and you're taking in 1 trillion, then the 200 billion has to come from somewhere. And that comes from the trust fund. Remember the trust fund that has surplus over the years? Well, that surplus is now being spent. Every year, they are taking money to make up the deficit between how much money is coming in and how much money is going out. That's another fact. So that's the situation we're in right now. Now, as I said, a lot of you have said things that, oh, Congress took money out of the account. They never paid it back. I think you said Lyndon Johnson was the one that changed the rule so that Social Security payments go into the general fund. All that is true. But my point is that there's also a demographic layer that is on top of what's happening right now. So when you hear people talk about the Social Security Trust Fund is going to run out of money, they mean that that surplus bucket is going to run out of money. And then at that point, we have less money coming in than money going out. The money going out has to be reduced. And that is how you're going to get the 21% reduction in benefits if nothing is done at all. If Congress does not do anything to fix the system, then something is going to have to change, which is that they are going to cut benefits for current and future retirees. So, having laid that foundation, now let's talk about what can be done to keep the Social Security system solvent, to fix it so that you can get 100% of your benefits, and then future retirees can also get money that they've paid into the system. So again, I'm going to use a simple framework to explain how that works. So we are talking about money coming in. It's a pay-as-you-go system. So the money coming in has to match the money going out. And so how do you do that? Well, to fix the system, you either bring in more money into the system, or you slow down how much money is being taken out of the system. That is how you're going to fix it, or you do a little bit of both. So let me explain 5 different ways that that can happen. So I hope you are with me so far. If you are, let me know. I want to hear where you're watching this from, your city and your state. Hit me in the comments. If you have any specific questions about what I'm talking about, you can also ask me in the comments. So let's talk about the 5 ways that Social Security can be fixed. We have to either bring more money in, or we have to slow down money that's going out. So the first option is to increase the Social Security tax rate. Currently, Social Security is financed by a 12.4% tax rate that is split between the employee and the employer. So when you're working and they're taking taxes out of your Social Security check, 6.2% is taken out of your check, and then your employer matches the other 6.2%, that is 12.4%. The proposal is to increase that 6.2% to 6.5% over 6 years. That way, it's a gradual increase, but that is going to ensure that more money can come into the system, and support the money that's going out of the system. So that's proposal number 1, increase the Social Security tax rate. What is that going to do? Well, it affects everybody that is earning wages. So it is broad and impacts everybody. So it will collect quite a bit of money. And that proposal alone, if they implemented that, will solve about 20 to 25% of the shortfall in the trust fund. So it's not a complete solution, but it is a solution that helps fix the trust fund issue by 20 to 25%. So that's the first proposal. Let me know what you think about that. The second proposal is to lift the cap on Social Security taxation. What does that mean? In 2025, if you make up to $176,100, you have to pay Social Security taxes on anything up to that amount. It's called the Social Security earnings limit. If you make more than $176,000, you don't have to pay Social Security taxes on anything above that. So if you make $200,000, anything above $176,000, you don't pay the 6.2% tax on Social Security. Social Security does not collect money on your income above $176,100. If you're a millionaire, you only have to pay Social Security taxes on your $176,100. If you make $500,000, you only have to pay Social Security taxes on $176,100. If you're a billionaire, you only have to pay Social Security taxes on $176,100. You get where I'm going with this. So what that has done is that 20 years ago, only 10% of the population made more than $176,100. Today, it's about 20 to 25%. So there are more people that are making more money above the limit that are not paying taxes on their earnings. So that is also another way to bring in money into the system. So if they only did that, if they lifted the cap on Social Security earnings, that alone is enough to fix the shortfall for 75 years. You heard that right. If all they did, if they didn't do anything else I'm about to talk about, the only thing they did was lift the cap on earnings, they're going to solve all the problems that Social Security Trust Fund is having for 75 years. And it only impacts 4% of the population. So that is proposal number 2, just removing the earnings limit and then you solve a lot of problems. Proposal number 3 is to increase the retirement age from 67 to 69, the full retirement age. Now, what does that mean? Well, so President Reagan was the one that increased the current retirement age from 65 to 67. And it's been slowly creeping up from 65 to 67. So in 2025, if you're retiring at your full retirement age, it is 66 years and 10 months. Next year, 2026, that number is going to go permanently to 67 years. And that has been a change that has been happening since President Reagan was president, and slowly increasing from 65 to 67. Well, here's another fact. People are living longer. Retirement is longer than it used to be. And so people are collecting benefits longer, which is stretching the Social Security system. Because, I mean, the system was not designed to pay benefits for how long people are living now, which is a good thing. Long life expectancy is good. We should all aspire to live long and healthy lives. But the thing is that retirement is longer. And so people that used to collect Social Security benefits for maybe 5 to 10 years before they die are now collecting 15, 20, 25, 30 years. And so the system is paying more money. So another way to slow it down is to increase the full retirement age from 65, 67 to 69. Now, there's a problem with that proposal. The first one is that it affects low-income household more. Why is that? Because people in lower income household tend to work, very stressful and maybe manual jobs. And so their life expectancy are generally lower than people in high income households. So if you increase the full retirement age at which somebody can get their full benefits, then you are putting the burden disproportionately on low income households. So that is the problem with that proposal. And another problem with that is that people don't want to wait till 69 to get all the money that they've paid into the Social Security system. Of course, you can retire at 62, but you're going to get 30% less of what you had paid into the system, and that's permanent. Once you make the decision, I think you have a year to change your mind, but you have to pay it all back. But after that, you're stuck with that amount for the rest of your life. And so if you start receiving benefit at 62, you're getting 30% less. But if you want everything that you're entitled to, you have to wait till your full retirement age, which for some of you is 66 and change or 67. You can wait till age 70 and even get more. So increasing the full retirement age not only disproportionately affects low-income households, but it also is a no-go for a lot of people because people have been waiting all their lives to retire and get their money, and to wait till 69 when the average life expectancy for a male in America is 73 and a female is 76. So if you wait till 69, on average, you probably get Social Security for 4 years as a male and 7 years as a female on average, versus the current 67, where you get a bit more time to enjoy your benefits. So that is proposal number 3, increase the full retirement age. Let me know what you think about that. Proposal number 4 is means testing. This is very controversial because it means that they're going to determine benefits based on how much money you have at the time of retirement. So if you are wealthy, you may not get as much Social Security benefits even though you've paid into it. Currently, regardless of how much money you have, whether you're a millionaire or not, you're going to get your full Social Security benefits when you retire. So if you've paid into the system and you're supposed to get $4,000, the maximum Social Security for 2025 is $5,108. So if you are wealthy and you've paid the maximum all your work life and you retire today, you're going to get the $5,000. They're not going to say, oh, you have more money, so you don't deserve it. They're going to give you everything. So a proposal is on the table to means test Social Security, to look at how much money you have at retirement and then adjust how much money you get as a way to slow down how much money is coming from the system. Well, the argument for that is that, if you don't need it, then maybe you should go to people who need it more. But the argument against that is that I have worked for it, I have paid into it. It doesn't matter how rich I am, I paid into the system, give me my money. So that is the means testing proposal about fixing Social Security. Let me know what you think about that, because that idea is a very controversial idea, and I think that it's going to be hard for Congress to pass it. So another proposal, which I think is solid, is that a lot of rich people escape Social Security taxes. Majority of the population that are working in regular jobs get W-2 income. So when you file your taxes, your employer gives you a W-2, it's W-2 income. And so you have to pay Social Security taxes on it. But if you are wealthy and you have different sources of income, then you are going to be able to avoid taking your income as wages and maybe claim all your income through capital gains. So maybe you sell a few stocks here and then you take your money through capital gains and you don't pay yourself wages. And so if you're not paying wages, you don't have to pay Social Security taxes. So another proposal is to make sure that anybody earning any form of income, whether it's wages through employment or capital gains through selling, your stock, or however else you're getting your money as income, that you are subject to Social Security taxes. Currently, only wages, employment wages or self-employment income is subject to Social Security taxes. So those are the 5 proposals that are on the table, maybe 6 that I've gone through to try to fix Social Security. And I want to hear your thoughts, because this is happening now and something has to be done. And given what Doge is doing, Elon Musk and Doge, that is a whole different ballgame, because they are going after fraud, waste, and abuse. Whether they're going to stop there is another issue. It remains to be seen. We are all witnesses to that. So we're going to see what happens, because he's saying that he's going to, eliminate fraud, waste, and abuse. Well, we'll see. But on top of what he is going to do, on top of what Elon Musk is going to do, the proposals I've shared with you is what is in front of Congress right now that is viable to reform Social Security and make sure that not only retirees that are getting money right now can continue to get their full benefits, but future retirees also have access to the program. So let me know your thoughts in the comment section. Now, there are 2 more things I want to talk about, and then we can wrap it up today. The other one is Medicaid. So there's a lot of activity going on around Medicaid right now that I think a lot of seniors are not paying attention to, or I think a lot of seniors are in denial about. So let's talk about it. It is an open forum. We can have an honest conversation. So if you're a senior and you're low income, you should care about Medicaid. I know you're on Medicare right now and you think that, oh, I'm on Medicare, I don't have to worry about Medicaid, but you probably should. And I'm going to give you a couple of reasons why Medicaid is so important to low income families and that it should be protected. So the first thing is that 72 million people are on Medicaid right now. And 30% of all Medicaid spending is to support Medicare. Now, let me explain that. There are low-income seniors that are on Medicare but cannot afford to pay Medicare Part B premiums and other services that Medicare does not provide that they need and cannot afford. So they are eligible for Medicaid. And in those cases, in those seniors, and if you're on both benefits, I want to hear from you in the comments, because I don't think a lot of people realize that 30% of Medicaid spending is supporting just Medicare enrollees. But let me explain what that means. So if you're on both, which is dual eligible, you're getting Medicare and Medicaid, and your Medicaid program pays for your Medicare premium, your out-of-pocket costs, your deductibles, plus other services that Medicare does not cover for you: dental, vision, prescription, etc. So now that they're talking about cutting Medicaid, which is part of the budget proposal that just passed the House, Google it. You will see that the House of Representatives has asked the Energy and Commerce Committee to cut $800 billion from their budget. Well, the Energy and Commerce Committee is responsible for making legislation on Medicare and Medicaid. And those two programs forms about 95% of the money that that committee is responsible for. So if you're asking a committee that is responsible for Medicare and Medicaid, and 95% of the money that they can mess with is supporting Medicare and Medicaid, then you're asking them to cut one of those programs or both of them. What they're going to do remains to be seen, but let me explain to you why you should care about Medicaid. Number one, I've explained to you that a lot of seniors are both on Medicare and Medicaid, and they depend on Medicaid to pay for their Medicare premiums, deductibles, out-of-pocket costs, vision, dental, etc. The second part, which is even more disturbing and why you should care about Medicaid, is that 62% of all nursing home bills in this country are paid for by Medicaid. Now, let me repeat that again. 62% of nursing home long-term care facilities depend on Medicaid to pay the bills. Why is that? Well, when you get to a stage where you need long-term care, you need nursing home care as a senior, and you don't have long-term care insurance, which is super expensive, or you don't have $90,000 a year to go stay at a nursing facility, and that's how much on average it costs a year to be at a nursing home, $90,000. And you don't have kids that can, care for you at home and take care of you, then your only option is Medicaid. And Medicaid will pay for your nursing home stay until the end. So when they are talking about messing around with Medicaid, it's also going to impact seniors. And I'm saying that this is what is out there. This is what the committee has been charged to do. And so the more noise people make and show that they care about the program, the more politicians will listen and protect those programs. So if you think, oh, I'm on Medicare, I don't have anything to do with Medicaid. If you're low income, you may need Medicaid in the future. Another thing is that veterans depend on Medicaid a lot. And this is another population that's going to be devastated if there are drastic cuts to Medicaid. So why is that? Because not all veterans qualify for VA healthcare. So if you're a veteran and you're low income and you can't qualify for VA healthcare, Medicaid is one of the places that you can get benefits. If you're working in about 36 states, they've expanded Medicaid to adults without dependents. You can get Medicaid if your income is less than 138% of the federal poverty level. And then there's children health insurance. 50% of all births in the United States. This is data that you can verify for yourself. 1 out of 2 children that are born in the United States are paid for by Medicaid. Isn't that mind-blowing? 1 out of 2 children born in the United States are paid for by Medicaid. So Medicaid is everywhere. And so that is such an important program that cutting Medicaid is going to affect a lot of people, including seniors, including children, including veterans. So that is what I wanted to talk about. And then the final thing I want to talk about today as an update is let's talk about food stamps. So there's a couple of things I want to share about food stamps that I think seniors will find really important as we head into this season of a lot of news that you don't know which one to pay attention to. Well, there are a couple of things you have to pay attention to when it comes to food stamps. The first one is that right now, if you are getting the minimum benefit, a lot of seniors are saying, I'm only getting the $23, it's not worth it. Well, are you getting all your deductions in when you filed for food stamps. That's one area that seniors have very generous deductions that include health, that include other bills that you're paying that are eligible to be deducted so that you can get more money. So at minimum, if you don't think that you are getting the food stamp benefits you deserve or are eligible for, you can go back to your caseworker and tell them, hey, I want you to reopen my case and I want to make sure that you've deducted everything that is eligible. I am paying this, I'm paying that, I'm paying that, I'm paying that on a monthly basis. Which of these things are deductible? Because you'll be surprised. There are standard deductions and then there are other deductions that seniors can take that can help them get more money. Even if you're getting $23 and you go for a review and you end up getting $50 or $75, that is triple the amount you're getting right now. So if you don't think you're getting all your deductions, it is worth noting and it's worth looking into. The second thing I want to talk about regarding food stamps is food stamps fraud. A lot of seniors are getting their food stamps stolen because the card that you're using, your EBT card, may not be secure. So I'll give you two things to look for. When you're using your food stamps card, especially if you're not using it in a big grocery store and you're using it in a small, local store, that is opportunity for people to put devices on the pin pad, and then they can take a screenshot of your card and then go reproduce the card later and then drain your benefits. So just make sure that you're paying attention to where you're putting your EBT card and typing in your PIN. And if you're in a particular place where there's only one person manning the whole store and the retailer, and they don't have time to be paying attention to everything, those are the opportunities where people can sneak out and put skimming devices on the EBT pad and collect your information. So make sure that you are using it in secure places. When in doubt, touch the PIN pad and make sure that there's no plastic on top of it. That is how they get your PIN. And then do not give your card or share your card details with anybody, because your EBT department, your food stamps department, will not call you and get your PIN over the phone. So scammers are calling seniors, telling them that their EBT card will be canceled if they don't answer some questions. And then they'll ask you personal questions and get all your EBT information and then go use it later. So let me know what you think. I still want to hear from you where you're watching this from. If you have any questions, I want to go through and see if I can answer some of them. Make Medicaid, this is Regina 5327. Make Medicaid eligibility anyone making 50K or less a year. Well, that's the thing. So currently, Medicaid eligibility is 138% or 135% of the federal poverty level. So that is probably, but some states, not all states, have opted in to expand Medicare to all adults without dependents. So I think there are about 36 states that have done it. So if you live in a Medicaid expansion state and you're making 138% or less of the federal poverty level, which is not that much, you should be eligible for Medicaid benefits in your state. There's a lot of talk about Elon Musk and what he's doing. Well, I'll let you guys debate that. I think it remains to be seen what his true intentions are, so we'll find out. There's a question about Social Security. So is Social Security going to be around? Now, here's the thing. I think that Social Security is going to be around. The question is, are you going to get all the benefits that you've paid into the system? That question is yet to be answered, because as we all know, or you can find out today, the Social Security Trust Fund is going to run out of money in 2033. President Trump wants to also eliminate taxes on Social Security benefits. Let me talk about that for a second. That is a great idea. He wants to cut taxes from Social Security benefits. About 40% of Social Security beneficiaries currently pay federal taxes on their Social Security benefits. That proposal is going to cost $50 billion a year to implement. And that money is going to come out of the Social Security Trust Fund. You remember the trust fund that I talked about in the beginning? That money is going to come out of that. So while eliminating taxes on Social Security is a great idea, and 40% of current beneficiaries and future beneficiaries will benefit, it is also another drain on the Social Security Trust Fund. So based on that alone, it is predicted that the Social Security Trust Fund will run out of money 6 months earlier. So it will be 2032. By June 2032, the Social Security Trust Fund will run out of money if the president goes ahead and implements his Social Security tax bill. So on one hand, he wants to cut taxes on Social Security benefits. A lot of people are happy. Great idea. 40% of people will benefit. On the other hand, that is another money that's coming out of the trust fund every year that, should be money that goes into the fund. So every taxes that seniors pay on Social Security is additional income that goes into the Social Security Trust Fund. And it accounts for 4% of the money that the Social Security Trust Fund gets every year. In addition to payroll taxes and interest on the Social Security investment, taxes on Social Security benefits brings in 4% of the money. So by eliminating that, you're going to make a lot of people happy, but then you're also going to put some stress on the trust fund. So is Social Security going to be around? I think it will. Whether you're going to get your full benefits is the question, because if things go the way they're going right now until 2033, then automatically they're going to cut benefits by 21%. That is the low point. It may be more, depending on what Congress does and doesn't do in the next couple of years. Let me see if there's another question I can answer. Why do seniors get $23? Well, these $23 for food stamps is the minimum benefit you can get. And the reason why is that a lot of seniors make too much money. I know, right? A lot of seniors make too much money to qualify for food stamps, even though the income eligibility requirements for seniors is much more generous. If you look at the income limits for seniors, you have more leeway than everybody else. So the regular population has a much tighter income limit. In most states, seniors have up to 165% or even 200% of the federal poverty level, whereas everybody else is 136%, or even in some states it's 100%. So seniors have more room. And then your asset limit for seniors is also higher. For the regular population is $3,000. For seniors is $4,500. So everything is more generous for seniors when it comes to food stamps eligibility compared to the regular population. The problem is that a lot of seniors, based on your Social Security income and additional income that you may be making, you still make more money. So if you qualify, and the way they calculate your benefits, if you qualify, they're going to give you the minimum benefit because they cannot give you zero. So they're going to give you the minimum, which is $23. Now, I know there's a lot of Congress people that are proposing that the minimum benefit for food stamps should be increased to $75. I am 100% in agreement with that. I think $23 is kind of an insult in a way, because it doesn't even buy a day's worth of food for a lot of people, a lot of families. So increasing it to $75 minimum is probably what makes sense. So I am in favor of that. Let me continue to look at questions and see if there's something I can answer. Is Congress going to pass the Social Security, no tax on Social Security? Well, here's the thing. So there's a lot of different things happening in Congress right now. They just did a continuing resolution, which pretty much kicked the can forward till September in terms of the budget. But then there's also another budget proposal that's going to deal with President Trump's tax cuts and other issues. And that is going to be done under the Reconciliation process. You will be hearing a lot about reconciliation. It is a budget process that allows the Senate to vote on things with a simple majority. Rather than having 60 votes, it's going to be so. If anything is going to be done about the president's proposal to cut taxes for Social Security, it's going to be part of that reconciliation bill that is rolled up into all the things that they want to do regarding extending President Trump's tax cuts into the future. So that is not going to happen right now. It's probably going to be like maybe in the fall before they're going to get to that. But it looks like the president has proposed it. He's talked about it since the election. And if he's going to put a tax cut together, a tax cut package together, I'll be surprised if that is not included. But it remains to be seen if that's going to happen. Okay, somebody's asking about Social Security cap. Okay, so let me explain that. Maybe I'll answer two more questions and then we can wrap up. So one of the reasons why a lot of seniors have to pay taxes on Social Security is because Congress did something that even today still does not make sense, which is that if you make $25,000 or more as an individual, you're going to pay Social Security taxes on your earnings. As a couple, I think it's $33,000, which is a whole different topic. I don't know why the couple amount was not $50,000. If an individual is $25,000, couples should be $50,000, but they made it $33,000. That's a different conversation. But that was done in 1983. And since then, they have frozen that cap. So it has stayed at that number since they started. Now, here's the problem. When they put in the $25,000 and $33,000 for the couple limit, that was during the Reagan years, only 10% of the population, only 10% of seniors were eligible, because $25,000 in 1983 is a different amount today. But Congress did not index that amount to inflation. So it has stayed $25,000 and $33,000 for all this time. And so what has happened is that over the years, more low-income seniors have been caught up in that net and are paying taxes on their Social Security because they make more and are collecting more. But it wasn't designed that way. But Congress did not index the Social Security tax limit to inflation. And so it has stayed 25,033, and I don't know why they don't want to move it. And so each year, more people are getting caught up in that, and more people are paying taxes on their Social Security benefits. And that is why a lot of seniors are frustrated, because that is what's happening. So any other questions? I've really enjoyed hanging out with you guys today. I hope you've learned something. Or will Medicare and Medicaid be cut? Well, I'm going to answer the question in different ways. So let's start with the broader question, okay? Because I think that it's important for us to understand the big picture when these discussions are happening, so that we can also provide our input. So entitlement spending. Now, I know when we use the word entitlement, a lot of seniors get upset because they say Social Security and Medicare are not entitlement. We paid into it. I understand that. But I'm explaining to you the government's term, how the government classifies all of this when it comes to budget. So stay with me. Social Security is number one thing the government spends money on. Yes, you paid into it, but it's the number one. Medicare is number two. National defense is number three. Interest payment, Medicaid is number four. Interest payment is number five. Now, Medicare, Medicaid, Social Security, food stamps, all of them are considered entitlement benefits for budget purposes. And let me make a distinction here. There are two types of entitlements. There is the entitlement that people paid into, like Social Security and Medicare. And then there's the entitlement that comes from the general tax revenue, that is paid out of general tax revenue. That is Medicaid, food stamps, veterans benefits, etc. Now, here's the thing. They are saying that they want to do entitlement reform. That is what Elon Musk went on Fox News and said recently. You can Google it for yourself. They want to do entitlement reform. What that means is that they are looking at everything. Why would they want to look at everything? Well, as I explained earlier, there are some challenges to Social Security and Medicare that something has to be done. Yes, you paid into Medicare, but Medicare cost has risen dramatically, partly because insurance companies and the healthcare industry keeps increasing prices of everything. And because Medicare is an entitlement, let me give you an example. For instance, if this year 1 million people have to get dialysis, okay, Medicare has to pay for that. Well, if next year 2 million people need dialysis, Medicare has to pay for that. Well, the problem is that the prices of these treatments keep going up dramatically. So the cost of treatment of the Medicare budget keep ballooning. Now, that is not the senior's fault. It is the system that is, gone crazy, where these hospitals are charging crazy prices for these things. And so when Congress is talking about entitlement reform, it could mean many things, but part of it is that they are not willing to do the hard things that need to be done, which is rein in the prices of how fast healthcare costs is going up. Because what's happening is that Medicare will get the bill from the hospital and say, this is the bill, and then Medicare will pay it. So if next year 2 million people need the same service, Medicare will get the bill and pay it. Medicare does not have endless amount of money. And so what happens is that the government keeps paying these bills that the hospitals say they owe, rather than Congress stepping in and addressing the exponential rate at which healthcare costs is increasing, that is putting a strain on the system. So I don't think that services will be cut for individuals, but I won't be surprised if they begin to limit how much services you can get. And that is not a function of anything other than skyrocketing healthcare prices. That is my opinion, because I'm looking at the data and I am seeing that things cannot go on this way if the healthcare companies are going to say, this is what this cost this year. I mean, you guys know this on Medicare Part B. This year, Medicare Part B cost went up by 6.5%. Meanwhile, your cost of living adjustment for Social Security went up by 2.5%. And that is the way things happen every year. Medical cost goes up dramatically, higher than everything else, and nothing is done to rein it in. So at some point, the system is going to break because the cost cannot be ballooning, and there's not an endless amount of money for the government to pay it. I'm just giving you facts. These are facts that's available to all of us. You can Google it. You can ask your AI to tell you all these things, and it will get all the information and bring it to you. So I hope that helps answer that question. Would food stamp increases be? So the thing about food stamp increase actually is going to go in the opposite direction, because if you remember, during the Biden administration, there was a big increase in food stamp benefits. I think it was like a 30% adjustment. It was an adjustment to something called the Thrifty Plan. You should look into that. The Thrifty Plan is the way that food stamps are adjusted on a wholesale basis to catch up with inflation. Before that adjustment was done a few years ago, it had not been adjusted in a long time. Well, the proposal in front of Congress right now to reform food stamps is to take away the agricultural department's ability to update the food stamps Thrifty Plan. And if they do that, then it means that your food stamp benefits is not going to be able to rise as fast as inflation. So then your food stamps purchasing power is going to fall behind inflation, if that makes sense. So are your food stamps going to be cut? I think the first thing you should look for is that if they slow down how much cost of living adjustment or food stamps increase you can get every year, that is going to be a cut in itself, because it kind of just limits how much or how far your food stamps benefits can go. So I hope that makes sense. All right, let's see. Every time we get a raise, our Medicare cost goes up. Absolutely. I agree. That's Terry Gallegos. Yes, it is true. And that is the frustration that a lot of seniors have, is because when you get your food, your Social Security cost of living adjustment, this year, the average Social Security recipient got about $40 increase. If you're on disability benefits, you got $29 increase. But then your Medicare Part B premium went up by 6%. So it feels like, you're either even out or you are slightly below, because your Medicare cost eats up all the Social Security increase every year. So seniors are always behind, and everything has gone up and stayed up: food, medicine, transportation, fuel, clothing, everything, rent, mortgages. So, yeah. So one last thing I'll say before we wrap up. So there's a lot of changes happening in the Social Security Administration. Elon Musk is working on limiting fraud, waste, and abuse. One thing I'll encourage you to do is go online and set up a My Social Security account and make sure that you download your earnings statement. Why is that important? Well, you never know. We all hope that everybody has good intentions and everything will be great. But if they break something in the Social Security system and all of a sudden your benefits are distorted, then you have your earnings statement that you can go to the Social Security Administration and show that this is how much money I made and this is how much money I'm entitled to. That is just a good thing to do so that you can have peace of mind. Because when you hear 19-year-olds, 20, 21-year-old programmers in the Social Security system touching things and messing around with things when they are not trained on that system, you wish for the best, you hope for the best, but just download your statement and keep it. It doesn't hurt. At least you have your earnings record, so that if something happens and you have to prove that you are eligible for the money that you are eligible for, you have the statement to back it up. So I really enjoyed hanging out with you guys today. If you have any more questions, drop it in the comments and I will go through them. And when I do my live tomorrow, I'll answer some of your questions. I hope you have a good night and see you soon.